The Kiambu County government has embarked on an ambitious program to redeem the health sector that has for years embarrassed the regional government due to poor infrastructure, faulty equipment, unnecessary delays of services, acute shortage of drugs, and congestion, which has been worsened by malpractice of a fraction of health workers. From launching a 100 million shillings universal healthcare program, expansion, rehabilitation, and equipping health facilities, stocking of drugs and non-pharmaceutical suppliers, and reorganizing hospital boards, to installation of a healthcare management system, the country's fourth regime hopes to restore public health sector's confidence. Governor Wamatangi has also put on notice healthcare workers in public facilities, a section of whom he has fingered for malpractice after preliminary investigations revealed some own private clinics or colludes with to divert drugs meant for public hospitals, which have for years hit the headlines due to poor service delivery, despite the health dockets getting annual budget of 4 billion shillings. He noted that the program also entails improving working conditions and motivating workers. Wamatangi has also intensified impromptu visits in public hospitals as part of his efforts to force change in running of the affairs, saying his administration, which has been in office for about 4 months now, is installing a health management system to ensure accountability, and already the tendering process is underway, adding that all hospitals in the county will be installed with security surveillance cameras. Further, the county, according to the governor, is partnering with donor international organizations and National Health Insurance Fund in the ongoing establishment of a universal healthcare program, which he said was one of which campaign promises to put at least 1 million people in a health insurance scheme to ensure the access to quality healthcare. Presently, data obtained from the Health Services Department shows by Wednesday evening, which is less than 2 months since the launch of the exercise, the county has so far registered approximately 100,000 families, majority of who are from the bottom of the pyramid, and according to Wamatangi, the exercise ends in March or mid-April when the data will be consolidated and linked to an insurance scheme. Speaking at Ngecha, Limuru Sub-County on Wednesday when he toured the UHC registration centers for monitoring, the governor said after the ongoing mass registration, which he said will end in March, the data will be consolidated and together with the donors will put at least 1 million people in a health insurance scheme. To ensure that the UHC program succeeds, the governor announced that his administration is improving all its facilities in order to be ready for any needed services. Presently, works have resumed in Wagige, the Goto, Bibirioni hospitals, whose construction had stalled due to non-payment of bills by the previous administration, as well as a drugs and non-pharmaceutical store in Riro following payment of pending bills by the current governor, with the Riro facility expected to serve as central store for all the 123 health facilities in the county. According to the County Executive Committee member in charge of health services, Dr. Alan Minor, the store, which is 95% complete, will be installed with a management system that will also be linked to all facilities in the county for proper management and efficient monitoring of service delivery by, among other things, ensure all health facilities will be restocked with a click of a button. In December last year, Wamatangi flagged off trucks loaded with drugs and non-pharmaceutical supplies worth 60 million shillings, which were dispatched to the county hospitals, although the governor has decried that part of his was diverted. Presently, the county administration is undertaking a second round of disbursements, with the county chief firing warnings to medical practitioners that any of them who intends to use the supply for commercial purposes should quit and engage in private business or bear the consequence, a move that has already sparked protest among a section of health officials led by Hilary Kibiriti, who is the county secretary to the Health Workers Union Caucus, and chairman Dr. James Githinji. Reporting for the Informer, Catherine Shallow.